Welcome to our sixth episode of the HLI podcast. Today, we have Khalid Garba Mohammed, a pharmacist from Nigeria with experiences ranging from hospital and community practice to NGOs to academia. I'm excited to hear about the realities of pharmacy practice in Nigeria and how he's preparing our future pharmacists for their very important roles. Welcome, Khalid. First of all, let me congratulate you on the completion of your PhD thesis. Finalizing a PhD is a colossal achievement in of its own, but for someone like you, I know it's just a stepping stone for even greater things to come. And I know through this experience, you've been able to touch upon the lives of many individuals and contribute immensely to the pharmaceutical field. Could you share with us a bit of your professional journey?
Hello, Susmita, and thank you so much for the congratulatory, and thank you also for the kind invitation to this very innovative program. My professional journey, as you have mentioned already, I am a pharmacist, a graduate from Nigeria, from Ahmadu Bello University. That is the same university I also got my master's degree. And then I proceeded to University of Milan, where I just finished my PhD last January. I have been working with hospital, community pharmacy, and then later I joined academia because I do have passion for it. So in addition, I also do some voluntary work, especially with the International Pharmaceutical Federation, where I serve different roles, such as, for instance, I'm part of the FIP COVID-19 Global Expert Advisory Group. I'm also serving currently as a liaison for the Young Pharmacists Group to the FIP UNESCO University Training and Networking Unitwin Program. So in brief, that is me.
That's a lot of hats to wear, and you've excelled at all of these. And I didn't want to give it away that both of us are ABU alumni. Exactly. I want to share a little story about how we first connected. I remember when I saw your name and I saw the ABU, I was like, okay, I need to reach out to this person and connect.
Same yeah, I remember. WHO, WHA 2019. Yes, yes.
It was just amazing. And I know I was so proud that you were presenting. And it really seems so far away, right? Like, I think when
exactly.
we connected, which was this, 2019?
2019, yeah. For me, that moment was a home from far away. Just meeting you, yeah, and discussing the ABU, I mean, undergraduates in your days and during our days. It was kind of, though we never met, but it was somehow, I can call it some kind of reunion.
We were separated in time, but not in thought.
Yeah.
And then the next thing was, oh, I'm going to do this all over again next year. And somehow we're sitting here 2 years later and we're like, oh my God, what just happened, right?
Exactly.
And I think this is what's on everybody's mind. It's like, oh, like COVID, right? I mean, it's really disrupted on many ways.
Yeah, a lot.
And I'm sure our viewers would love to hear, how has it affected you personally and professionally?
Well, this is also interesting question. I remember I was in Milan back then, last year, around January, February, when the peak of the pandemic was rising. So emotionally, I must say I was affected. I remember becoming psychologically low, I can say.
Wow.
Why? Because my family was far away from me then. I was just studying in Milan, my family are at home in Nigeria. So, but eventually, after things started becoming normal, or I may say when we started to accept the new normal back then, then the psychological aspect started to at least stabilize. On a professional ground, I may say, yes, partly it affected my PhD research activity because I remember our laboratories were shut down completely for nearly 3 months with no access, except that the university gave some adjustment that if you have a professor with an ongoing research, at least a professor could assess the laboratory with some specific restriction and specific guidelines But after all, as you mentioned, the PhD has been defended, so everything is fine now.
Perfect. Yeah, and I think that has been one of the teachings, that despite everything that's happening, we're resilient. And
yeah, the resilience. Yes, I perfectly agree with that. Yes.
Yeah, but at the same time, I think we're all social creatures, and this has been really hard on a different level. And it's really like, it brings us to so many questions about isolation we have had to have. What is the support system we have?
Yes,
Right?
because I was like just discussing, this might be a side, I was discussing with some colleagues here in Nigeria. I was like, okay, they say, oh, last year by this time we were completely shut down at home. I was wondering like, wow, so how did you manage? Because there is this disparity in terms of social amenities. I was back in Milan, we were in total lockdown, but at least the social amenities are functioning: electricity, water, all the necessities that you need at home.
Exactly.
But here in Nigeria, it's a developing country, so there are still some things to be fixed, like electricity, for instance. So if you are shut down completely, access to some of the things that you need are necessary. They told me was really challenging. Yes. So
yeah, I think
this is also
that true.
some differences.
I think that's one of the things that has also come up, that even being in a total lockdown is almost a privilege, that you can do it. Just the things you're mentioning, right? Like,
exactly,
do you have access to your social services, to utilities? On top of that, can you actually go into lockdown? So this is not only relevant for frontline health workers that have to go out of work, other frontline health workers, but just even people who earn a wage that you cannot earn sitting at home. I have to say we're privileged that we're able to carry on with the work, whether it's educational or professional, without the need of exposing ourselves and the disparity, right? I think thinking better, I think that all comes into all this health policy discussions, and how do we think about it, and how we need to take all these into effect. And you're right, I can imagine for your colleagues, how did they isolate? I for me, when it all started, I was actually in Geneva, because of the isolation, because of all this, the new normal, as we call it.
Yeah, the adjustments.
Like for me, I remember when I'd put on a mask initially, I would almost feel a little anxious, not because of the mask, but I think because then I was aware of what the reality was.
Exactly. Right? I remember also my first week in the laboratory when we resumed, and they made it mandatory for everyone to wear the face mask.
Yeah.
It was a new normal also, but then I experienced consistent headache for like 1 week. Because of the consistent use of the face mask, but subsequently it's the headache subsided actually. So all these are the part of the adjustment you have been talking about. I mean, how you adjust, how resilient that showcase how resilient we are to reach up to this moment. Yes, enduring and so on.
How have I'm curious to know, how are you managing? What are some of the things you've done that's different or the same, done more of? Like, would you like to share with us on that?
Yeah, sure. This is very interesting question, because I told you the initial part of the pandemic, I was in Milan, so it was somehow scary for me back then. Well, I tried to manage my mental health back then by trying as much as possible to be somehow far away from news, because news is one of the things that scare me, Yeah. So because the moment I log in, I tried to check news, I see the death toll is rising, the number of cases are rising from on case by case basis, country by country. I became scared. So, but later I realized, okay, let me have, even in a day, a single time that I will check the news, but not consistent as I used to be to do before. So that actually, that actually helps a lot, because sometimes, getting a lot of information often is confusing. So I restrict that. And then secondly, my professor told me, okay, you can work from home, obviously. Even though at the beginning, still I couldn't do anything. I always was just thinking of what is happening and what could happen to me. But later on, I adopted the working at home policy. I write part of some chapters of my thesis, because I was in my third year then. Then I started writing. So some of the coping strategies. When you are doing something, you keep yourself busy, at least some of the thoughts of the pandemic at least are lowered. And then when I get back home to Nigeria, I also manage myself by keeping myself busy, because when I returned, still the pandemic was still, a bit alarming.
Yeah.
So I kept myself busy working with family, especially with my daughter and my wife. Often we cook together, we watch movies together. So that's how actually I try to manage my personal mental health and that of my family subsequently.
Oh, that's wonderful. I'm happy that you have the time to your family and you're able to spend quality time with it. It's also time to rediscover, right, that family side of
Exactly,
ours.
exactly.
Yeah, that's wonderful. I think kind of segueing into one of the main groups that have been in focus, of course, are frontline workers, pharmacists among them. I know we have had numerous conversations about the realities of pharmacy practice in Nigeria. And our mutual interest we shared about was the abuse and violence towards pharmacists, both from patients, from other members of the healthcare team. And, I'd really love to hear about them. I know I really applaud the paper you published last year on this topic. It was so important, to bring all that knowledge and things together. I think people don't realize it. Even when I, submitted to the FIP, it was something people don't think that this really happens.
Yes, I understand your perception regarding that. Actually, for that paper you are talking about, I think the key motivator for me to actually focus on that research was based on personal experience. Personally, I told you I started as a hospital pharmacist. So that I could remember a time when, as a pharmacist in charge in one of the accident and emergency pharmacy unit in a hospital, public hospital, an incident happened. There is this congestion in the pharmacy. We have a lot of patients to attend to. And a medical doctor, a colleague, I can say, because it's a professional colleague, so came in a request for a control drug, a verbal request, which is obviously unethical. We are dealing with, drugs often that are between life and, death. So the doctor requested was a control drug. Not only a control drug, it's an injection. So on a verbal request, I declined. So for that reason, the medical doctor started abusing me. I still remember that. That was a key motivator for me to carry out that research on violence toward pharmacists in Nigeria. So, and I believe some of the factors that actually generate that can be associated with lack of enough pharmaceutical manpower, especially in our public and private hospitals, because at times you will see a long queue at a pharmacies in the hospital, patient waiting to collect their medicines after going through all the process of seeing the medical doctor, having to go through maybe laboratory tests. So obviously they could be exhausted, because often pharmacy is the last point where you just receive your drug and move on. So you can say that the client or the patient, in most cases, they are exhausted before reaching to that. So anything, any small thing can actually trigger their temper, and then they can initiate the violence. So part of it is lack of enough manpower, pharmaceutical manpower to be specific, that actually tend to actually trigger occupational violence toward pharmacists. Because I realize it's not only my personal experience, people do have a lot of that experience, either from the professional colleagues, from the pharmacists, from the patients, or from the caregivers often. True. So, but people just don't report it. And I found out that from the literature research we did, there was not enough documented literature on that occupational violence towards pharmacists. So that was the key motivator. And the findings were so fascinating, because what we found are just this, as I mentioned, there are several factors, some of the pharmacists linked to why it happened. Some of them, as I mentioned, the pharmaceutical workforce,
Mhm.
Some of them, the communication skills. Often the pharmacist speaks English, and when you are working in a setting where some of the, the local language of the patients or the caregiver is not English, so that is also another challenge, and that may predispose,
Yeah.
often either physical or verbal attack in terms of the violence.
Yeah, I
So
think that's just, sorry, I was just going to say, like,
yeah,
you raised two things that, pharmacists being that last point after, in the healthcare team, and it kind of is the
exactly,
last point before they're getting home. So it's
exactly,
like, it's almost built up,
exhausting.
right? And I almost think it's everything that's built up during that experience
The
with the
process,
contact
exactly.
from
Yes,
healthcare gets
exactly,
offloaded into the pharmacist.
exactly.
Right. And then in the US, the other thing that also comes in is because then you're billing insurance. Sometimes a lot of patients have this misconception that pharmacists are the one choosing what to put as your copay, which is not, right? It's really us being the middle person. And I think pharmacists feel this very important role of being the middle person in all these transactions. But unfortunately, that opens you up to a lot of the issues. So I think, yeah, those
Exactly,
are very, very important ones. And I think what you were talking about is patients understanding what's the clear role of the pharmacist, and also
exactly,
why it's important to feel this role is very important in understanding it. But at the same time, I think, we're aware of the human factors that make it possible. But pharmacists should not be exposed to it. Should be any kind of job you don't go in. You should have that safe and decent working conditions, right?
exactly, exactly, exactly. Especially you should feel safe, especially among other
Exactly.
healthcare professionals. I mean, among professional colleagues, they should understand you better. When you talk of patient, I think part of it is, as you mentioned, some patient think when you come to the pharmacy, the next thing is just for the pharmacist just collect your prescription and fill in your drawer and just submit. No, it's beyond that. The pharmacist need to sort out your drug, any other potential interaction, any other issue that as a professional he needs to address. So all this, and then when you don't have enough manpower, you expect obviously long
You're
waiting time.
frustrated,
So
yeah.
which also frustrates along the way the patient or the caregiver. So all
True.
this, I think, need to be addressed at grassroots level. For our own setting, for instance, in Nigeria, I think increasing the pharmaceutical manpower can address some of the challenges because it will reduce some of the waiting time, the patient waiting time, and at least it will give enough time for the pharmacist to interact in an open-minded manner with the patients and caregivers.
You're exactly right. And I would assume that, these were challenges even pre-COVID, right?
Yes,
Like,
yes, exactly.
yeah,
Obviously, these are pre-COVID even
these are
challenges.
pre-COVID. And I know
Yes.
in the US, we have been talking about this question of burnout because of the lack of manpower, because of all the roles, slowly, US pharmacists are getting into. How has it been like during COVID? Has this really gotten worse? Are there some things that have changed? Like, what have you seen?
Well, in developing countries like Nigeria, I can say a lot have changed actually. Um, for instance, already we talk about the pharmaceutical manpower, it's
Yeah.
challenging. But at the same time, for instance, pharmacists are not allowed to administer vaccine. That is even before the COVID-19 pandemic. So I think this is challenging. Why? Because as it is obtainable in other countries, for instance, like United States of America, I believe, pharmacists are allowed to administer vaccine. This will actually increase the rollout program for the vaccination, especially for adult vaccination. So which is something that the developing countries need to emulate, in particular like Nigeria. I think we need to emulate that so as to improve the coverage of the vaccination for the entire country.
Okay. Yeah, I know like in many parts of the world, what we were, especially specific to pharmacists, I think many of them did not even recognize pharmacists as frontline in the US and the UK. Initially, that was an issue. So that got a problem. There was an increase in the abuse and violence and discrimination against health workers, generally, and I'm sure also pharmacists included in that. And what you're talking about is exactly right with the vaccines. I think now we're getting, at least vaccines are available. So we have that bright line, coming up. And I think
Yes.
that would have, personally think, okay, great, we're getting closer, right? To where
Yes.
we can put this behind us. But you're right. I think having pharmacists part of the healthcare team is very important. In the US, we are seeing pharmacists being able to vaccinate, as you mentioned. So there is a wider rollout.
Exactly.
But still, just the coordination has to be very important.
Yes.
Right. I think one of the things, let me ask you, like, what do you think are some of the things we should do, right, to better plan for the next pandemic? And especially when it comes to, what would you suggest would be one of the things for pharmacy practice, right? Like to make it robust enough before the next pandemic rolls out.
Well, I think the entire world have experienced a lot of changes because of the COVID pandemic. So pharmacy included, pharmacy profession. So what some of the things that we could do, actually, we can try to adopt some of the measures that have been put in place during this COVID-19 pandemic. A lot has changed in terms of use of digital technologies, for instance. Even the development of the vaccine, I think for the first time in the entire history of this world, how the vaccine development of how COVID-19 vaccine development has been fast tracked. This is also something very fascinating.
True.
And I believe if as human and as professionals, if we can adopt how all these changes have occurred over a very transient period of time, and we try to improve upon them, I believe we can tackle the next pandemic in whatsoever form it may come in.
Mm-hmm. I think you're right. Like we were able to achieve this feat. I think this has been the fastest.
Yeah. The
Right?
fastest, yes. Within 12 months or less, several vaccines has been developed and they are now being rolled across the globe. I think it's a very big achievement, very huge, as
True.
far as I'm concerned. Yes.
True. And keeping up with this, and maybe getting some of the good practices that have come up to it, even in the pharmaceutical manufacturing space. How can we do it?
Exactly.
And even the
Exactly.
incentivizing, right? Like there was a lot of incentives for the government, because one of the things that vaccines, manufacture and development suffers from is the investment in it.
Yes.
Right. So I think that is
Yes.
a big part of it, that we have seen it's possible if we have the right incentive and to get it. And as we all know, prevention is better than cure, right?
Sure, exactly. I think, that leads me to actually something very important, especially in our setting. I don't know what is obtainable there over in the United States, the issue of vaccine hesitancy.
Mm-hmm.
It is very rampant here. I remember I went I took my first shot of the vaccine in last 2 weeks
Mm-hmm.
here in Nigeria. When
Okay.
I got to the primary healthcare center where I took it, actually there was nobody. I mean, it was empty. Only the vaccinators there.
Mm-hmm.
And they told me I was just either the first or they told me I was the first person to register online and came for the vaccination. So which
Wow.
means there are two things. One, either the hesitancy, or
Mm-hmm.
second, maybe the publicity of the awareness. I mean,
The
to
patient
make people
education.
aware exactly is
Mm-hmm.
less. So in our context, I think these two things need to be addressed. Both, I know there is issue of vaccine hesitancy even before COVID-19, even the conventional vaccination for
Mm-hmm.
children, there is this hesitancy. So a
Yeah.
lot needs to be done to enlighten the public in that aspect. And then now the COVID-19, people are not actually going there, not
Mm-hmm.
actually willing, are not much willing to actually take it voluntarily. So I think it's something that the government probably need to work on so as to enlighten the public on the
Yeah, I
importance.
think, that itself would be a topic on its own. And I think you're right. You kind of say there's so many angles, right? So many facets to
Exactly,
it.
exactly.
Because it's, sometimes we look at the effect, but the effect comes because there has been a cause for it. And the main thing for dispelling a lot of this is the education, educating people on what it is and then supporting them. You know, I think
Exactly.
what's been really great, like, you know, I'm part of a task force here, and one of the things we do is really tell people that you should also learn to report symptoms when they come up.
Exactly.
Right?
Exactly.
Because when
Exactly.
any medication, when it's in the post-surveillance marketing, not even vaccines, one of the
Yes.
main ways you can do changes is that people actually report the side effects and you develop through them. So I think there's a lot of things that need to be taken care of. And you're right,
Exactly.
these are part of it that we need to keep in mind before we have the next one. And
Exactly.
getting our pharmacists to be able to administer in Nigeria as well. You know, being a Nigerian pharmacist myself, I'm always happy to see, you know,
Yeah,
be
you must
able.
advocate that. Yes, you must
Exactly.
advocate that. That's what I have been advocating on a personal
Uh-huh.
ground. And I believe if we have multiple forces working or advocating for that, one day the government will listen and do the
Will do
needful.
it. You know, when I
Yes.
studied in Nigeria, this was not part of our curriculum. And I have to say, when, you know, vaccination became part of the duties for pharmacists here,
Hmm.
it was something like, mine is a different thing. I'm actually scared of needles, both for
Yeah,
myself and giving it to someone. So it had to be something I had to learn, but it's not something that you can't learn. And
I
later
can
on, like
imagine.
it was really good. Like I would actually have people who would come to me and say, "Oh, Susmita, I'm happy you're working today. I want my vaccine from you because when you gave me last year, you know, my daughter or me or, you know, somebody
You
was not
see, you see,
scared."
you see.
And I think maybe because I am that way, I'm able to recognize and put somebody at ease and talk through them
Yes,
when I'm giving
yes,
the vaccine. So, and
exactly.
yeah, and it's something I think it's not that
Kind of advocacy on your own as a professional. Yes,
exactly.
yes, yes, yes.
Well, I think those are very, very astute insights, Khalid. I'm so glad that you're in charge of educating our next generation of pharmacists in Nigeria.
I'm glad to.
Is there anything in particular you'd like to pass on to your students and actually pharmacy students globally on how best to prepare themselves for practice and elevating the profession?
Well, a very nice question. Thank you so much for this. Because actually, I used to tell my student always, you should be ready as a pharmacist and as professionals, healthcare professional in particular. You should always be ready to embrace technology. The world is ever evolving. I mean, the technology, when you are talking about pharmacy profession, it is always evolving. You can imagine, for instance, probably when you graduate from ABU Zaria here in
Mhm.
Nigeria, your degree program was Bachelor of Pharmacy, right?
Exactly. Mhm.
So yeah, so now my university, the same country we are running Doctor of Pharmacy program, PharmD.
So cool.
So
Yeah.
you can imagine the paradigm, you know.
Mhm.
So I should always embrace technology. The profession is ever evolving, so that to meet of the ever increasing need of the patient. Some of these technology or innovation that they must be willing to embrace include digital health,
Mhm.
personalized medicines. We are talking about issue of personalizing dosing even nowadays.
True.
So innovative drug delivery systems such as oral dispersible films and many, so many others that are still evolving. So all these are essential because if you want to meet up the needs of the patient, so as to also enables you to practice globally, not only within your locality. So you should be able to embrace those changes and you should be able to develop yourself professionally along the way as you grow through the career in the pharmacy profession and
So,
practice.
so true. And you are actually on the forefront of this. I have been to part of your presentations, and you're doing such a great job and, you know, really encouraging people to do it. So I really thank you for that. And you're right, you know, technology is definitely the next frontier. You know,
Exactly.
and for me, what I hope, like what I kind of advocate for is that while we're making these advances in the fields, we actually involve health workers right from the start, you know, in the
Yes.
design and decision making, because sometimes,
Exactly.
right, like we end up with products that sound great, but then they
Hmm.
don't really solve the issues on the ground. And I'm always like, okay, we don't want to come up with these apps. We don't want to come up. It's not only the user that we should take, you know,
Hmm.
the information from, but also the people who are going to actually be using these apps for their
You
patients.
are absolutely right. I think I may come in here because
Uh-huh.
you just reminded me during my PhD when we were conceptualizing the idea of my PhD. Actually, I work on personalized oral dispersible films. We use 3D
Mhm.
printing technology to
Yeah.
personalize dosing of the drug loaded in oral dispersible films. So one
Mhm.
of the things we just look at, okay, what is the aim of the entire project. When we look at the aim is to address personalized issues. For instance, pediatric dosing of drugs, for instance, issue of patient with dysphagia or patient with peculiar problems. Okay, in order to achieve the design of the drug delivery system, it's not only about the technology. Okay, what about the clinicians that will be made to understand how this dosage form works? They have a peculiar problem with their patient. How can this technology solve their problem? Okay, how can we also at the same time engage the patient themselves to let them understand? Because, for instance, the oral dispersible film is an innovative drug delivery platform. It's just coming off as a tool in drug delivery. So you are right when you mention it's not all about what you have developed. How about its utilization? Who and who are going to be stakeholders in utilizing that technology, for instance, you are developing, be it in a digital health or a drug formulation or a device for tracking adherence. So you need to engage multiple stakeholders so that at the end of the day, when you have the product, you also have the people to administer or utilize that product effectively.
Yeah, and you know, like health workers who are working with these patients are the ones to know what is really possible, right?
Exactly.
And what really happens.
Exactly.
And you point to a very important point that while this is going on and we expect them to involve us, we on our part should also be well versed to be able to communicate to these discussions and position ourselves effectively to make this happen.
Exactly.
Well, thank you so much for being here today.
Thank you too for the invitation. It's an honor. Yeah, it is really an honor. Thanks a lot.
You're welcome. I really love having you, and you know, I'm hoping we're making ABU proud. I'm happy that you know you are guiding our next students, and I'm hoping your students have their ears open when you're giving them all this advice.
Sure.
Well, thank you so much, and I hope all of you enjoyed this conversation. I look forward to all of you joining our next session on June 10th. At this time, we really hope to mix it up a bit. We're planning to have a Facebook Live session, so you'll be able to interact with us in real time. As always, we welcome your suggestions, questions, and comments on our social media pages, or email us directly at podcast@healthlawinstitute.org.